In early 2025, Texas was hit by the worst measles outbreak the United States has seen in more than 30 years. Over 4,500 people were infected across multiple states and Mexico. At least 16 people died, and hospitals were overwhelmed. But according to a new investigation, this wasn't just a natural disaster. The Trump administration's interference with the CDC left frontline health workers feeling abandoned, right when they needed help the most.
So what went wrong? And what does it mean for America's future in fighting disease outbreaks?
In January, children in Lubbock, Texas, were hospitalized with measles. Soon, absentee reports showed dozens of kids missing school with similar symptoms. Local health director Catherine Wells quickly realized this was serious. She emailed state officials warning that the outbreak was much larger than reported numbers showed. But when she reached out to the CDC for guidance on everything from how to test infants to how clinics could disinfect rooms, she hit a wall. Weeks passed before CDC scientists called her back. By then, one child had already died. One CDC researcher later said, "All of us trained for this moment, and then we weren't allowed to do anything." Local health teams scrambled with limited guidance while cases multiplied across counties. Hospitals and clinics worked overtime as testing lagged and contact tracing struggled to keep pace. Why the silence? The investigation shows that in the administration's first weeks back in office, CDC communications were frozen, and staff were cut. Data was censored and scientists felt muzzled. At the same time, Health Secretary Robert F. Kennedy Jr. was publicly questioning vaccines and suggesting vitamins like vitamin A could protect children from measles. Parents rushed to buy supplements and cod liver oil, believing they were safer than vaccines. Doctors in Texas began treating kids not just for measles, but for vitamin A poisoning as overdoses appeared in clinics. The outbreak spread fastest in Mennonite communities across West Texas, places with low vaccination rates and deep mistrust of government. Public health workers struggled. Some families refused testing, refused to name contacts, and avoided clinics. Others feared speaking to officials because of immigration status. With only 18 staff covering 4 rural counties, local health departments were overwhelmed. Wells wrote in February, "I'm so overwhelmed." Contact tracing slowed, vaccines were challenging to deliver, and community outreach met resistance. Despite tireless local effort, cases continued to climb as the system strained at every level. On February 26th, tragedy struck. A 6-year-old child died of measles. Only then did CDC scientists finally reach out to local officials, nearly a month into the crisis. That same day, the CDC issued a notice recommending vaccines, but also pushing vitamin A treatment, raising alarm among doctors. Behind the scenes, CDC scientists said they were under pressure from HHS officials to include vitamin A in guidance, despite the risks. Parents who had already given large doses faced dangerous side effects, complicating clinical care. Clinicians balanced treating measles complications with managing possible vitamin toxicity. By March, the outbreak had spread into New Mexico, Oklahoma, Kansas, Colorado, and across the border into Chihuahua, Mexico. In total, over 4,500 infected, 16 confirmed U.S. deaths, and likely many unreported cases. Experts say this is a warning. When science is sidelined and funding is cut, misinformation spreads and outbreaks become the new normal. As one CDC scientist put it, they had their hands tied behind their backs.
The Texas measles outbreak shows us that when trust in science collapses, the cost is measured in lives lost, often the youngest and most vulnerable. Do you think politics should ever influence outbreak response? Let us know in the comments. Like and subscribe for more deep dives. Thanks for watching.